This collection is for lower teeth and this for upper. Now starting with the lower remaining root forceps, the beaks touch each other and there is no space between the beaks. Lower anterior forceps, there is a slight space between the beaks, and that's how we can differentiate it from the lower remaining root forceps. Lower remaining root forceps, its beaks are narrower than the lower anterior forceps. Now, lower premolar forceps, the space between the beaks is larger and there is no notches in the beaks. Lower molar forceps, if you can notice the beaks, there is two notches on its beaks, one to adapt on the buccal bifurcation and the other for the lingual bifurcation of the lower teeth. Lower molar forceps, also two notches on its beaks, but this is an American style and this one an English style or British style. The angle is 90 degrees in the English style and it's just a curvature in the American style. Now the upper collection. Upper anterior remaining root forceps, it's straight, there is no curvature and the beaks do touch each other. There is no space between them. Now upper anterior forceps, there is a space between the beaks and it's also straight. There is no curvature. Upper premolar forceps, it has a curvature and there is a space between the beaks. Note that also there is no notches on its beaks. Now the difference between the upper premolar forceps and the upper anterior forceps is the curvature. For the upper premolar it's curved, but for the upper anterior it's straight. Upper molar forceps, it has one notch. The notch should adapt on the buccal surface of the tooth between the mesiobuccal root and the distobuccal root. So like this, and that's how we can tell is it right or left upper molar forceps. We look at the notch here. The notch should adapt buccally. We hold it like this, the curvature here on the palm, and so this is the notch, should adapt buccally. So here's the buccal, so it is for the right. Now this is another upper right molar forceps, but the difference in the handle here. This is the notch, we hold it like this and we adapt it on the buccal here, so it is right. This is an upper third molar forceps. Note the beaks, there is no notches on its beaks. Note the curvature here and the angles. We hold it like this and it's universal, we can use it for right and left. Okay, it's for the posterior, not for the anterior, because it has a curve to adapt on the posterior area, and as we know there is no space between the remaining root forceps. Elevators. This is a Copeland elevator. Straight. The proper way to hold the elevator is like this. The most important thing is the index should should be rest on the trunk to get stabilization. Copeland elevator is a type of straight elevators.
Yeah.
Warwick James elevators. Straight Warwick James elevator. It's universal, used for right and left. This is left Warwick James and this is right Warwick James. Now, how to know where is the right Warwick James and where is the left? We look at the tip of the elevator. So we make the convexity toward us. The tip is curved for the left, so it is left Warwick James elevator. And for the right, this is the convexity toward us. The tip is curved for the right side, for your right side, not patient right side. So it is right Warwick James elevator. Now, how to use the upper Warwick James elevator? We put the concavity of the elevator on the mesiobuccal surface of the tooth, of the third molar, like this, and we push backward and buccal. Now for the right side, this is the concavity. Put it mesiobuccally. Cryer elevators. This is a left cryer elevator and this is a right cryer elevator. How to know left from right? We make the convexity of the tip toward us, the smooth surface here, not this surface, not the concavity, but the convexity toward us. We see the tip, it is directed to the left side, so it is left cryer elevator. Now, this is the convexity. The tip is directed to the right side, so it is right cryer elevator. Now, we use cryer elevators when there is one empty socket and the other root in its socket. We put the cryer elevator in the empty socket and we push the other root. So for this left cryer elevator, where we can use it, this tip should be put in the empty socket, this, so we can push the distal root of the tooth. Now we can use it the other side, push the mesial root like this. So we put it in the empty socket here and we push the mesial root of the molar. For the upper, we put it in the empty socket and push the mesial root. From the other side, right side, we put it like this and we push the distal root of the upper molars. But never ever use cryer elevators to extract third molars or to remove any roots of the third molar, because we might cause tuberosity fracture.